Hi, and welcome to another episode of the Healing Lyme Summit. I'm your host, Dr. Mariah Hinchy. And today we're going to be talking about the relationship between vector borne infections, PANS, PANDAS, and basal ganglia encephalitis. It seems that neuropsychiatric disorders are definitely on the rise. And it is really important to know what the underlying cause is so that you can get the proper treatment. And I think that this is super important when you have a neuropsychiatric symptom that comes on abruptly. And in my opinion, when this happens, infections should always be ruled out as the underlying cause. So, here to walk us through this really powerful discussion is Nancy O'Hara, MD. Dr. O'Hara is a board certified pediatrician. She is a expert in pediatric special needs. She is a leader in educating both the public as well as medical providers in how to treat autism spectrum disorder, PANS, PANDAS, mold, Lyme, COVID, all of these complex chronic medical conditions. So, welcome, Dr. O'Hara. Tell our listeners a little bit about yourself and how you came to treat all of this.
Thanks, Mariah. And it's always a pleasure to work with you and talk to you and see you. So thanks for inviting me. I started my career as a teacher of children with autism, and I was a really lousy teacher. So as I always say, I took the easier road and went to medical school and started treating children with autism within my general pediatric practice. And then I realized that I really, through my own infertility, through what I was seeing in patients, needed to do it through more of a functional medicine approach. And 30 years ago, my mentor was Dr. Sidney Baker, who is the grandfather of functional medicine. So I consider myself very, very lucky. And certainly, 15 years ago, when my own son developed seizure-like tics after getting bit by a Lyme positive tick, getting a live virus, and strep throat all in the same week, um, I began to learn about and then treat PANS, PANDAS, and basal ganglia encephalitis. So I'm thrilled to be here, and I'm thrilled to increase the awareness of this devastating illness.
Thank you. We all very much appreciate you being here. So, let's start out by talking about just as simple as possible what is basal ganglia encephalitis?
So the basal ganglia is the area of your brain that is really important for anxiety, tics, OCD. And what happens with basal ganglia encephalitis, that means that area of the brain is inflamed. And that happens after an infection. It could be strep, as in PANDAS, pediatric autoimmune neuropsychiatric disorder associated with strep. So with that, what happens is rather than the antibodies attacking the strep in the throat or on the skin or in the anus, those antibodies instead cross the blood-brain barrier and attack the basal ganglia and cause inflammation in the basal ganglia. So we're seeing this in our pediatric population, but also in older kids and adults. And strep is only one. That's why in 2012, they changed the name or made it more all-encompassing to include PANS, which was any abrupt onset neuropsychiatric symptoms associated with mycoplasma, Lyme, viruses. And now we know so many different infections can cause this, not just Borrelia, but also Bartonella, Babesia, COVID, and many, many more.
So the main difference is that with PANS, it could be any infection that basically predisposes or brings this out. And with PANDAS, it's always associated with strep.
That's correct.
Okay. So can you go over how this would present in a patient, like how the symptoms would come on and how they would progress? And do you see a difference between PANS and PANDAS as far as the presentation, or is it really only the trigger being strep with PANDAS that differentiates between the two?
In my opinion, it's mainly just the infection that triggers it, that differentiates it. I don't see that many differences between the behaviors that come out. But what you have to do is be a detective and figure out that 6 weeks 2 weeks, 3 months, but usually somewhere between 2 and 6 weeks, there was an infection of some sort, COVID, or they got bit by a tick, or they had a strep throat, or a close contact had an infection of some sort. And then they devolved into these neuropsychiatric behavioral changes. So the main one is OCD, compulsive thinking, intrusive thoughts, obsessions about the way things are done or turning light switches on and off. The types of OCD are just plethoric. And then 2 of 7 very common symptoms, and they include separation anxiety. So you can't leave mom's side all of a sudden, or behavioral regression, starting with baby talk, or motor abnormalities like handwriting deterioration or tics. And then mood disturbances, the sensory stuff. They go from 0 to 60. They're fine 1 minute and they're raging or crying the next. And then somatic symptoms, like all of a sudden they start bedwetting after being dry at night, or they can't get to sleep, or they have very restless sleep that's called REM disinhibition. So those symptoms come on abruptly. Now, there are a few caveats to that. One, that first incidence may well be minor. So they get a strep throat. 2 weeks later, they have behavioral changes. They go in to see their doctor. The strep culture is still positive. They put them on a better or different antibiotic, and they get better and they figure out all about it. And then 3 years later, they have a more subacute presentation, but it's much more severe. And they don't even recognize that there was a germ associated with it. They had a cold, but no big deal. That second, third, fourth iteration, A is more severe and B can be more subacute. And then the other thing is, this is pediatric by definition. PANS and PANDAS, the P is pediatric. However, because we live in such a toxic world, our blood-brain barrier, just like our guts, are becoming more leaky. And so the ability of these antibodies to cross the blood-brain barrier is even more frequent. So that's why I don't think it's just my skewed view of the world. I think it really is increasing. And then finally, when the trigger is Lyme, Borrelia, Lyme co-infection, Babesia, Bartonella, or mold, then the presentation is often more subacute. And all of those reasons, the leaky blood-brain barrier, and particularly with the tick-borne infections, it can affect people much older than just the pediatric population.
Yeah, and I think we've seen a lot of that, with a lot of the neuropsychiatric stuff, like with long haul COVID.
Yes. Yes. And I think there's
So,
excellent research. I'm always looking for the silver linings and things.
mm,
And the silver lining of COVID for me is maybe there were a few more people that recognized basal ganglia encephalitis, recognized autoimmune encephalitis, and saw that, yes, there is a post-acute infectious syndrome that can occur. I don't care what you call it.
right,
Really, all of it is causing inflammation in the brain, and we
right.
need to do something about it.
So this obviously a big piece of this, just like vector-borne disease, is clinical diagnosis. But what testing do you find helpful? I mean, everything from specialty testing down, looking at autoimmune antibodies down to looking at, things that you could order at a local lab.
So the first thing is it is a clinical diagnosis. And so many of our families cannot afford to do a lot of the specialty testing. And so because of that, I use the history and physical exam more than anything else. They're my top 10 biomarkers. After that, it's inflammatory markers. Is this child showing evidence of inflammation? Is there a high C-reactive protein? Regular lab. High sed rate, regular lab. High ANA. ANA is the most commonly positive test. Now, 13% of kids, neurotypical kids, will have a positive ANA, but a low level. 60% of kids in our practice, 56% in the literature, will have elevation in a non-specific pattern of the anti-nuclear antibody, or ANA. then I still get strep titers, ASO, anti-DNase B. I get mycoplasma titers, IgM, IgG. I will look at what virus it may be. Is it mono? Then I may get an Epstein-Barr panel or a CMV panel. Is it COVID? I may look into looking at the markers for that. Is it measles? It depends on what I hear from history. With Borrelia, Bartonella, and Babesia, I think we need to use one of the gold standard specialty tests, and they are more expensive. So I do a lot of clinical acumen, detective work before deciding on which test to get for each child. But if I do need testing, I will use the specialty labs for Borrelia, Bartonella, and Babesia.
Okay. So, what is your current understanding in the relationship between vector-borne diseases? I mean, it seems obvious with PANS, but with PANDAS, is it that they're weakening the immune system and the body can't deal with a strep load that like a typical child that doesn't have an infection would be able to deal with? Or can you just elaborate on how the vector-borne illnesses could bring this out in somebody?
Yeah. So, first of all, genetics loads the gun and environment pulls the trigger. So it's 1 in 200 children, even though it seems like 1 in 1 in my practice. It's 1 in 200 children that get PANS, PANDAS, or basal ganglia encephalitis, and they have a genetic susceptibility for this misdirected immune response, for the molecular mimicry. All of us build up antibodies or proteins within our blood when we get an infection. That's part of the ways we fight the infection. But instead, in these kids that are genetically susceptible, those antibodies or proteins cross the blood-brain barrier and attack a different area rather than just the strep in the throat or the mycoplasma in the sinuses or whatever it may be. Those antibodies cross the blood-brain barrier at the cribriform plate and attack the microglia or the little cells within the basal ganglia and cause those to become inflamed. When they're inflamed, then we get the neurobehavioral symptoms.
And then how would something like mycotoxins further exacerbate that?
Right. So mycotoxins are from mold. And many of our children, 42% of children in our practice who come in with basal ganglia encephalitis are positive for Bartonella. 41% of the ticks in our area carry Babesia. And a little under 40% of the kids in our practice also have mold mycotoxin disease. So in this case, there's an inflammatory response, again, a genetic susceptibility. They're exposed to a water damaged building or mold of some sort, and the antibodies attack the basal ganglia in the same way as with the infections, but also cause many other symptoms that you see with mold illness, particularly brain fog and those ice pick sensations, etc., that we see.
Okay. And then when it comes to like mycoplasma, why something that for a lot of people is just so innocuous, like mycoplasma, why does this make? Because sometimes this is like one of the few organisms right in the picture. So why does this cause such an issue in some of the kids?
Well, I think one of the reasons is just what you said, because it is often silent in pediatrics, the kids don't get sick with it. They're not getting put on appropriate antibiotics or antimicrobials because nobody knows it's there. Grandpa may have mycoplasma pneumonia, but they don't know that it's there. In addition, the antibodies that are elevated, even the chronic antibodies with mycoplasma, there have been 2 more recent studies now that have shown that just by having those antibodies, that immune response increases the severity of tics and anxiety in each of these 2 studies. So that antibody response is mounting without appropriate, what should be the 3-pronged approach, but certainly without the antimicrobial piece of that. And that's why mycoplasma is always there. So I'm always checking for it.
Mm,
And as you well know, it's also considered a Lyme co-infection.
right.
So, a lot of those are silent, unfortunately.
Yeah. So what symptoms would make you think tick-borne disease in a child with PANS or PANDAS?
So one of the most common with Borrelia is brain fog, um, cognition or executive function deficits. So if I've got that in addition to PANS, PANDAS, or certainly have any muscle, joint aches, the typical type malaise, fever, I will look for Borrelia. With Bartonella, I'm looking for a constant daily flare. Mostly with PANS and PANDAS, the flare is episodic. It comes and goes. It waxes and wanes. With Bartonella, it can be daily with no relief. The next thing with Bartonella, it can be rage. Rage, aggression, agitation. I'm always thinking Bartonella. Then another piece of history, or I may find it on physical exam, is foot or sole or heel pain. That is very common with Bartonella. And if I see a little kid rolling up their socks, I may well see that. And then finally, the striae, blanching stretch marks that do not follow dermal lines. They're either horizontal or vertical anywhere, usually on the back, but I've seen them on the knees, I've seen them on the back of the neck, etc. And then with babesia, night sweats, dysautonomia, dysregulation of the automatic nervous system, air hunger, cough and rib pain, but even GI symptoms together with those neuropsychiatric anxiety, OCD, tics, I may think of Borrelia, Bartonella, or Babesia for all of those reasons.
Okay. So obviously it's really challenging to diagnose all of this. What would you tell patients or parents really in this situation to be on the lookout for?
Um, First of all, find a clinician like yourself, or me that understands, that listens, that's there to help figure out the story. Second, if you have any abrupt onset of any of the symptoms I've talked about, anxiety, tics, OCD, especially together with handwriting deterioration, urinary symptoms, or sleep disorders, go find somebody who knows something about PANS and PANDAS. And then, especially in the area of the country where we live, finding a tick is important, but even if you don't find a tick, Borrelia, Bartonella, and Babesia are so common. Be thinking about it and asking about it and testing for it when appropriate. And then we need to talk about what to do about it too.
Oh, and we're going to get there. Don't worry.
I know we are.
So I have a question. Are there other things that can cause basal ganglia encephalitis besides infections? Like, are there toxins? Are there different things, or is this almost always some type of infection?
Sure, great question. So first of all, PANS does include other metabolic, not just mold, but pesticides, chemicals, anesthesia, other adjuvants that we may get inoculated with, for
Mm.
example, all can be triggers for an immune response. You want to mount an immune response to any of these things. That's what our body's supposed to do. It's when that immune response is dysregulated. So yes, thank you for reminding me that PANS does include any other metabolic trigger that's of an abrupt onset.
Okay. And so we are going to dive deeper into treatment in a few minutes, but let's just kind of go over the basics. So, when you're going to treat someone, what would you say is the basic effective treatment? And I know that's a hard question to answer.
It's always a three-pronged approach. So I make sure that I have something in for each of those prongs. So one is treating the symptoms, and you treat the symptom that is most problematic for the patient and the family. Nobody's sleeping, then you got to treat sleep first, whether that be valerian or melatonin. And as a functional medicine practitioner, I am always using the plethora of wonderful botanicals, herbals, and nutraceuticals that we have at our disposal. And very rarely do I have to go to more than that. So number one, treat the symptoms. Figure out the most important one and treat that first. Second, antimicrobials. It may be an antibiotic, antiviral, antifungal, but it may well be an antimicrobial rotation of herbs, especially if you have more than one trigger. Oftentimes, we'll have a child come in with Bartonella and strep or Babesia and Mycoplasma. Using a rotation of herbs can be very helpful in those cases. And then third is the immune modulation. So treating the immune system, decreasing that inflammation. You can start with something as simple as ibuprofen. 10 milligrams per kilogram of ibuprofen decreases the severity, frequency, or intensity of the flare of behavior. You know you've got to do more immune modulating agents. Aloe, curcumin, quercetin, other antihistamines, multiple different agents long before we get to steroids and IVIG.
Okay. So I want to go deeper with all of this here. But before we get there, why don't you tell our listeners how they can find you and share with us any exciting news or new? I know you have programs and you have your book. So just tell our listeners how they can get their hands on those.
Absolutely. So my website is drohara.com, drohara.com. There you'll find information about my book and how to order it from Amazon. You'll find information about my mentorship, and I'll work with you for 15 minutes or 5 hours. You can come to my office or I'll go to you. And that's for practitioners mainly, but I will mentor parents also. And then finally, I have a membership, which is ever increasing. 30 new videos out this year and 30 that are already there, 5-minute segments on all of these different things we talk about, monthly teachings, live and recorded, Q&As with experts in the field, and a group of lectures, all available through the membership. So drohara.com, you'll find all of that.
Wonderful. Thank you. Okay, so Dr. O'Hara, let's go back in. Would you like to expand on those three treatment points?
That would be great. So let's start with symptoms. And OCD being one of the most common one. NAC, N-acetylcysteine, is one of my favorite. It has 17 studies behind it, and is really very helpful in decreasing OCD. Others that are helpful are GABA, lithium orotate, adaptogens, ashwagandha, rhodiola, holy basil, many others like that. And CBD, hemp oil. Be careful though, kids that get THC or a full spectrum CBD may actually have an increase in psychosis, OCD, or anxiety. So watch what you're using and work with a practitioner on that, and many, many others. I have to talk about diet because, when you're talking about inflammation, you have to decrease the inflammation in the diet. So decreasing processed foods, decreasing inflammatory foods like carbs and sugars, and increasing veggies, proteins, and good oils as much as possible is really important. And exercise and getting out, playing in the dirt. I don't want people who are worried about ticks to isolate and be inside all the time. We need to get out there. So those are very important symptom protocols too. When we talk about symptoms of ticks, for example, I would add to that magnesium. Magnesium is one of my favorites in treating constipation, citrate or oxide, and in treating brain fog, in treating ticks, in treating anxiety with glycinate, threonate, and others. And, there are many, many other that are just for treating the symptoms. Then when I talk about treating the inflammation, I look at essential fatty acids. One of the biggest mistake we make with fish oils is A, not using a good brand, and B, not using enough. We want to increase the dosage as much as possible, watching for any easy bruisability or nosebleeds, because that may indicate mast cell activation or other issues the child's having with the fish oil, but increasing that as much as possible. Aloe, which is terrific, again, for constipation, but also great in decreasing inflammation. Curcumin, one of my favorite curcumins, is a liquid form that helps decrease anxiety as well as decrease inflammation. And there are many good forms of curcumin, keeping in mind that cumin needs to be mixed in a way or formulated in a way that makes it more bioavailable. So if you're not sure, adding ground pepper to curcumin to turmeric, like can be helpful. Golden milk, the milk is the emulsifier with turmeric, but look for a good brand when you're looking at turmeric and curcumin. Quercetin, also highly bioavailable forms, is a great antihistamine that I like to use for mold disease, as a bioflavonoid for inflammation, etc. And then finally, the antimicrobials. And, there's a lot of research now about herbal formulations with regard to tick-borne disease. And I have to say, the one thing I've learned over the past several years from you and other naturopaths that I work with is the value of really good herbals in the treatment of all these diseases. So you can do this without a prescription, whether it be Borrelia, Bartonella, or Babesia, or strep, mycoplasma, or viruses. You can do this without prescriptions. And one of the things I want to keep in mind is, one, when you're treating strep, sometimes when you're treating mycoplasma, when you're treating viruses, what you choose, the antimicrobial you choose first, may well work relatively quickly. When you're treating mold, when you're treating any of the tick-borne infections, you need to treat till at least 2 months symptom-free. So in my opinion, the minimum is 3 months, and usually it's much, much longer than that. It's 9 months to a couple of years. And so again, you do not want to use antibiotics for that long. Even if I'm choosing to use them first, I will as quickly as possible, switch to herbals because I really don't want the ill effects of the antibiotics. So using Japanese knotweed, Cryptolepis, cat's claw, Artemisia, Campsiandra, toba bark, and on and on and on and on, with multiple different herbs that you can use in combination, in rotation, and as warranted by the individual in front of you.
Yeah, that's great. I mean, one of the wonderful things about herbal medicines too is that you can get not only the synergistic effects, right? Like a lot of these antimicrobials are also anti-inflammatory, or they're also immune modulating. But additionally, cryptolepis is anti-parasitic as well
Oh
as
yeah.
antibacterial. So you can treat dual infections, whereas with, if we were using pharmaceutical antibiotics, you would have to be stacking those, on top of each other to get all of those effects. So it is nice.
Yeah.
Um, so as far as research, and I'm trying to think of how I want to word this because I'm specifically talking now with vector-borne disease, PANS and PANDAS. What research is out there, if any?
There really is a plethora of research. Brian Fallon and others in the 1990s were already talking about the underdiagnosis of neuropsychiatric Lyme disease. There are multiple research articles showing Lyme disease with neuropsychiatric symptoms. There's research with Bartonella and PANS. There's research written not too long ago by Dr. Erickson and others on Bartonella, as well as viruses causing basal ganglia encephalitis. There's research recently looking at Babesia odicoli, and looking at its effect and symptoms. Dr. Scott did that research recently. And then there are multiple research studies recently looking at herbals in the treatment of Lyme and Lyme co-infections. There are wonderful articles by Dr. Zhang, for instance, showing that Cryptolepis, Artemisia, skullcap, Japanese knotweed, Acornia all show inhibitory effects against Babesia, even greater than any of the antibiotics we use. Dr. Shore recently talked about nutraceuticals and the management of tick-borne disease. And Dr. Cheslick talked about Bartonellosis and the use of herbals. And there are multiple other studies over the course even of the last couple of years. And that's not to mention all the studies on COVID. And one of the things I wanted to mention about COVID and the kids or adults that get PANS or PANDAS or basal ganglia encephalitis after COVID is known to reactivate Lyme disease and reactivate mono-like illnesses. So when you have long COVID, it may well be a reactivation of Lyme disease or Lyme co-infections that you never knew you had. So there is a lot of research of late on that also, and COVID as a post-acute infectious syndrome also.
Yeah, and I've seen a lot of that personally in my practice. Okay, so what do you think parents need to hear regarding vector-borne illnesses and neurological symptoms just in general?
So first of all, it's a whole body illness. Putting an antibiotic on your kid to treat vector-borne illness is not going to treat the disease. This is not just a microbe or infectious disease. This is an immune system dysregulation. This is a total body illness. So you need to make sure you're using a three-pronged approach or a multi-system approach, looking at secondary effects of the spirochetes and the immune dysregulation also, like, for example, mitochondrial dysfunction, like, for example, food restrictions. I forgot to mention that 20% of our kids will present with obsessive or OCD-like food restrictions because of contamination, choking, or their OCD is they'll only eat green foods now or whatever. Also keep in mind that for parents, one, there is hope. Don't give up hope. Just because we sit here saying it may take you 9 months to 2 years, don't not start.
Right.
Find a practitioner to work with and start. Take baby steps. My kid won't take those herbs. They taste too bad. Well, there are ways you can take them. There are wonderful companies that sell them in pills. There are, ways to get the liquids in, and your child may not need 30 drops. They may need 1 drop.
Right.
We may, again, start low, build up slowly, but start. Take the first step. Also, if you can't afford the testing, these herbals are very safe. Work with a practitioner who can say to you, yeah, that sounds like Bartonella. Let's start with 3 months of Japanese knotweed, which also has resveratrol naturally, great antioxidant, let's start with a little cryptolepis. Let's start with, and get started. Even if you can't afford the testing, work with a practitioner to do that. And if you're working with a practitioner who's not listening to you, not helping you to do this full body approach, go find another practitioner.
Yeah.
And if you listen to those practitioners who may be listening, they will come, because that's really what parents want to be heard. They want to know that there's somebody in their court that's going to help them figure out why their child has changed, why their child is now an anxious mess on the floor. And so just get started.
That's the best advice. Um, I'm sure now after hearing all of this, parents are wondering, what can they expect long term? Once you have this, do you always have it? Are you always susceptible? Will your child ever go back to normal, whatever their normal was? What does this look like long term?
Yes, they can get better. The earlier the diagnosis, the better the outcome. That's known, but they can get better. And I'll give you a little story. And this happens to be the story of my son, because I have his mother's permission, at least, to talk about it. But when I diagnosed him, I treated him with a three-pronged approach right away for Borrelia, strep, and viruses. Treated the symptoms. His were seizure-like tics, treated the immune system, and he got better within 3 months. And I thought, hallelujah. And I missed Bartonella. So 5 years later, when I saw the stretch marks on his back, I was like, how long have you had those? And he goes, I don't know, Mom, I don't look at my back. And we started treating Bartonella. And 2 years later, he got the moldiest dorm room in the world, and he got mold disease. And 2 years later, he got COVID and devolved. His Lyme came raging back. But now he is a PhD candidate at the University of Michigan and doing wonderfully. And it wasn't until he got COVID, it was actually 2 years ago now. And I met a doctor in Michigan who believed, as we do, in vector-borne illness causing neuropsychiatric symptoms, that she's like, this isn't psychosis or anything else. This is Lyme disease reactivating from COVID. And I just thanked my lucky stars that I had found somebody else, because now he's an adult. Anyway, he finally said to me, all right, Mom, you may have been right. Because up until that point, I had helped him to bring himself up by his bootstraps. And so he never even thought he had PANS, PANDAS, or basal ganglia encephalitis. So finally, he was ready to read my book and, not just take stuff because his mom told him, but because it now made sense to him. But whatever the case, these kids can get better. There may be other triggers. If you miss something early on, as I even did, you may have to go back and retreat that. There may be something else, a virus or mold that comes up that hadn't been a problem in the past, and retreat that. But at every step of the way, they can get better. Couple other things to note: if your child gets basal ganglia encephalitis in the early years before puberty, most likely, as the blood-brain barrier starts to close at puberty, as long as you've treated all of the problems, they will get better. If they get it around puberty or a little bit after, the blood-brain barrier should fully close between 21 and 25, and they should get better then if you've treated all the other underlying problems. Of note, though, because our world is getting more and more toxic, Dr. Aguilera, many other people have talked about this blood-brain barrier breaking down, a leaky brain, just like a leaky gut. So again, back to that full body approach, you need to make sure you're helping your child to learn all the natural ways to detoxify: sauna, exercise, Epsom salts baths, pooping every day, and also, supporting their autonomic or automatic nervous system. So that's pooping, peeing, sleeping, exercising. It's the hot cold. It's the whole Wim Hof methods of cold plunges and sauna, but it's supporting their adrenals in addition to everything else you're doing, so that they have the resilience to fight back. And it's detoxifying this toxic world on an ongoing basis that helps them to stay healthy. But there is hope. They will get better. Don't give up, and just keep plugging.
Yeah. Start somewhere.
Yep.
Okay. Well, thank you so much for joining us. It has truly been an honor to have you here, and share with our listeners one more time how and where they can find you.
Yep. drohara.com. And one thing I forgot to mention is that I've just started a new supplement line that's only available to patients, mentees, people that mentor with me, or members. So go to my website, drohara.com, and you'll find a link to all of those, including the new supplement line and my book, my membership, my mentorship, and just find somebody that helps you, because it is doable. So thanks.
Thank you. And thank you, everyone, for listening. We will see you next time on another episode of Healing Lyme.